Hello there! Did you know that your heart might be sending urgent messages through your body? Yes, we're talking about signs and symptoms that, if detected in time, can be silent heroes in the fight against heart disease, which is the leading cause of death worldwide. So now, we go to the first signal, the mysterious Frank sign. This small fold in the ear of an unsuspecting person can be much more than just a mark of expression. It's known as Frank's sign because it was first discovered in the 1970s by Dr. Sanders T. Frank. This fold is a window into the health of your heart, signaling, especially in younger people, the possible clogging of the heart's arteries or even on the carotids. However, in older people, this sign can occur independently of heart disease. So, there's no need for you to lose sleep if your grandpa's ears are marked, but it's good to pay attention to the other signs to come. The second sign is bald legs, the thinning or loss of hair on the shins and thighs. More than a whim of nature can be a warning sign that something is not right with your circulation, pointing to the possibility of peripheral artery disease, which occurs due to atherosclerosis, a problem that can also affect the coronary arteries. If you have this sign, pay attention to the intermittent claudication, which is an intermittent pain in the calves triggered by physical exertion, and is another characteristic of peripheral artery disease. Another sign is Xanthelasma. These are small yellowish plaques on your upper eyelids. They are more than a cosmetic detail. They may indicate high cholesterol, a sign that your heart might be at risk. If you or someone in your family has this sign, there's no need to panic. Just search for a doctor and do a lipidogram, which is a simple and inexpensive test that evaluates the lipids in your blood. Another sign is the Senile Arcus. You know how in Hollywood characters often change their eye color when they receive some sort of special power? This color change in the eyes also happens in real life, but it's not supernatural. The Senile Arcus is this white or grayish halo that appears around the cornea. It is usually normal in older people, being present in almost all individuals which are 80 years or older. However, in younger people it is not common, being a warning sign of high cholesterol levels. Another sign for you to be attentive of is cyanosis, a bluish or purplish discoloration of the skin, which might be your body's way of saying that oxygen is not reaching where it should. This sign is fundamental to identify problems that can be either cardiac, pulmonary, or even in the microcirculation, as happens with Raynaud's syndrome, which presents with cyanosis on the fingertips of the hands or feet. But it's important to note that bluish skin is not always a symptom of a disease. Some common causes include exposure to cold, tight clothing, or jewelry, so watch out. Another symptom to watch out for is leg ulcers. These are wounds that do not heal on the legs. They can be a silent cry for help, indicating poor circulation due to arterial or venous obstructions, or even untreated diabetes. Arterial ulcers are usually painful and are located on the outer part of your leg, so this can help you differentiate them from venous ulcers. Another sign is swelling. Swelling, which we also call edema in medicine, is the swelling of the legs that can be a sign of your heart not pumping blood efficiently. Once the fluid in your blood, which we call plasma, is not moving at a normal speed, it begins to leave the vessels and seep into the tissues, causing edema. It's like the plasma is stuck in a traffic jam and just decides to get out of the car, resulting in the accumulation of fluid. In addition to these signs, symptoms such as shortness of breath, persistent cough, nocturia, which is the frequent need to urinate at night, and the intermittent claudication we just talked about, and also chest pain are very important messengers of your heart. Now, how can you become a hero of your own heart health? Well, you have to adopt a healthy and active lifestyle, maintaining a balanced diet, controlling your weight, quitting smoking, and regularly monitoring your cholesterol and blood pressure levels. These are the key to a healthy heart. Now remember that these signs and symptoms are not definitive diagnosis. They are lanterns that illuminate the path to prevention and care. They are not the final destination, but the beginning of a journey to keep your heart beating strong and healthy. Share this video with your friends and family. Your like can help save lives. And if you noticed any of the signs or symptoms, do not hesitate to seek a doctor. I thank you very much for watching, and I see you in the next video.